S-TRAC is the adjuvant randomized phase 3 study comparing Sunitinib with placebo in high-risk individuals with renal cancer who have had a nephrectomy and in surveillance and follow-up. It's an adjuvant study. You get a year of Sunitinib at 50 milligrams standard doses, and it's against placebo. And the trial shows a significant progression-free survival advantage statistically, with a hazard ratio of 0.76. The central review and the independent review are different from each other. The central review and the clinician's review, they're different in the results. One's significant and one's not significant. But essentially, the hazard ratios are 0.76 and 0.81, which are in the same ballpark as one another. And what that shows us is the results are marginal from statistical significance. One's just one side and one just the other side of significance. And that's really important. And there's no survival advantage in this study. The hazard ratio is 1.0. And that means we're not curing patients. Now, some people say that might be a bit early, but we've got a previous trial with Assure, similar design, which also didn't show, this one didn't show any progression-free survival advantage, and also didn't show a survival advantage. And essentially what this is showing us is that while we're showing signals that may or may not be promising for progression-free survival, we're not seeing anything in overall survival. And patients obviously want overall survival. That's the goal of this, because in the adjuvant setting, we are going to over-treat a group of patients who don't relapse. And so therefore, what I would like to see before I start recommending adjuvant therapy is I'd like to see either a positive progression-free survival meta-analysis, so we can confidently say you can delay the time of the cancer to come back, number one, future trials that are positive, or an overall survival signal starting. And one of the issues in the way I look at that is that if we had a small difference, a trend towards a survival signal, that would be promising and would suggest there's a relationship between the two of progression-free and overall survival. But because there's currently no relationship, it suggests to me that all we may be doing is just delaying progression-free survival, but not actually helping patients cure their cancer.